Hello and welcome to 72 Dragons Health. Today, we have the pleasure of speaking with Dr. Kristen Krause. Dr. Kristen Krause is an accomplished public health professional and educator, currently serving as an assistant professor at the Rutgers School of Public Health, New Jersey, United States. She also holds the position of Deputy Director at the Center for Health, Identity, Behavior, and Prevention Studies, a role she has held since August 2020. Her academic journey began with a Master of Public Health degree from New York University, where she actively enhanced the student experience through innovative orientation programs and curriculum development. With extensive research experience, Dr. Kristen Krause worked as a doctoral research assistant at the Center for Health, Identity, Behavior, and Prevention Studies, focusing on the health outcomes of young men who have sex with men. She conducted qualitative assessments, managed data analysis, and developed systems for tracking health-related data for reporting to the Center for Disease Control and Prevention, CDC. She serves as the program chair for the LGBTQ Public Health Work Group within the American Public Health Association. In this capacity, she leads initiatives aimed at addressing health disparities faced by sexual and gender diverse communities. Her expertise encompasses a range of issues, including HIV/AIDS, aging, resilience, and vaccine sentiments. Welcome to this interview, Dr. Kristen Krause. We are indeed honored to have you with us today.
Thank you so much for having me. The pleasure is mine.
Dr. Krause, what inspired you to become involved with the LGBTQ Public Health Work Group at APHA?
Yeah, so I had attended APHA a couple times when I was a master's student applying for doctoral programs. And because the work that I was doing was very focused on LGBTQ health and HIV, I think that the first year I just went to a couple of the different business meetings and socials that the sub-organizations were having. And so I got involved a couple years later with the LGBT Health Caucus because it felt like a way to make APHA more attainable in a lot of ways, because it was a smaller group. There was a lot of like-minded researchers. The program was manageable to attend in a lot of ways because there was only 8 or 9 sessions. So even if I couldn't go to all of them, it felt like I was getting a good snapshot of what was going on in the LGBTQ health world. So that's what initially sparked my interest when I saw that the program chair elect position was open. I thought it was a really, unique opportunity at this point earlier in my career to kind of help shape what the program looks like for the caucus and, make sure that different voices are being represented and that different types of research are being represented as well. Because I think it's easy in a way to kind of just rinse and repeat. And so it's been a really cool opportunity to try to expand and get a diverse group of folks involved in that way too.
It sounds like a great opportunity. Now, what specific projects or research initiatives are you currently working on related to LGBTQ health and identity?
The biggest thing that's come out over the last couple of months is a portfolio of work that I've been working on with my colleagues around vaccination uptake and sentiments in LGBTQ adults living in New Jersey and New York. And so we were really interested in examining COVID, but also examining the other vaccine preventable diseases such as hepatitis A and B, meningitis, HPV. We also assessed seasonal influenza before COVID and during COVID, because we were just really interested to see what that variation looked like. And so we recruited people between October 2021 and October 2022. And between that time, 96.6% of our sample had been vaccinated for COVID with at least one dose. And so that really spoke volumes to us, at least in how, the community really heeded those public health initiatives and warnings. We didn't necessarily see the same level of uptake across other vaccines. So there's certainly a lot of work to be done there, and targeting, prevention campaigns and ensuring that people know which vaccines they shouldn't have or should have, but also, helping people determine whether or not they have been vaccinated. I think vaccine records are one of those things that can kind of get lost over time, especially when I grew up, I think I still have the paper version that my mom wrote everything on from the doctor's office. And so now that, we have ways of tracking that electronically, these are going to be important things that we think about moving forward. And then the other piece of research that I have going on right now is looking at firearm ownership and sentiments among LGBTQ adults in the US, and kind of looking at the relationship between interpersonal violence, mental health. We asked a series of open-ended questions in a survey about, whether the increase here in the US in anti-LGBTQ legislation has impacted willingness or desire to purchase a firearm. For people who are interested in owning firearms, whether or not there needs to be more LGBT competent courses taught, either by providers who are LGBTQ or who are allies, and also kind of looking at the policy level. And so not a lot of work has been done in this area. So we're still very much in the trenches, kind of analyzing a lot of our qualitative data. Those are two projects that I'm working on right now in the midst of many others.
I can tell you keep yourselves very busy, very exciting and important projects. Can you discuss in particularly the impact of your work on young men who had sex with men in the context of HIV/AIDS prevention?
So that's another, I didn't even mention that part of my work, that is the HIV prevention, but also HIV treatment. And so I do a lot of work with older adults living with HIV, but I think prevention and treatment at this point in the epidemic go hand in hand, right? So we know that a lot of work that has been done with the U=U movement, so undetectable equals untransmittable. We know that, and that goes hand in hand, right? So the status neutral approaches that a lot of, major city health departments are kind of implementing, where, if you're at risk for HIV in New York City, for instance, if you meet any of those criteria that put you at risk and you go get tested, if you test negative, you get referred to pre-exposure prophylaxis. If you test positive, you get referred to antiretroviral treatment. So it's a way to really approach it in a neutral way, to say there's treatment available. There's treatment and prevention options available on both ends of the spectrum. And so really getting that message out and making sure that people are comfortable with it, understanding, now we're seeing so many developments in the injectable HIV treatment injectable space, meaning that folks may only need to go, 3 or 4 times a year to get an injectable dose of their HIV prevention or treatment medication, is certainly an important thing there.
Yeah, I can see the importance of prevention and treatment going together. And I understand it's a complex issue, but in your opinion, what are the most pressing issues in LGBTQ health today? And how can public health professionals contribute to addressing them?
Very big question. And I think, for the context of APHA and in public health, it takes so many of us from both, the social behavioral lens, which is where I come from, the health policy folks, the epidemiology folks, in the biggest picture, one of the challenges that we face here in the United States is that we don't adequately track sexual orientation or gender identity on the highest of levels. So meaning the US Census and the American Community Survey. And in the US, so many of our decisions based on what our congressional districts look like, how much funding those districts are going to get, where the priorities are nationwide for certain initiatives, we're not even being counted in those numbers. We're not even being represented in a meaningful way because we're not asking those questions. And so sure, we can look at the number of, same-sex households that exist, but that really doesn't paint the clear picture of, people living in areas that, poverty is much higher or food access is much more limited. And so those things all kind of come together at the highest policy level. Also, as I mentioned, the increase in anti-LGBTQ legislation, we know it's been well documented structurally that in areas that have, more anti-LGBTQ, insert any demographic here policies, that the health outcomes around mental health, well-being, that they're going to be, worse than in areas that don't have these policies. And so, ensuring that, LGBT folks become part of any federal legislation, the election coming up is a huge thing to consider when it comes to the future of federal policy. We have a lot of interesting things that'll be discussed at APHA this year. We're seeing more work being done with, indigenous groups, which is super important, and we're happy to see. A lot of work continuing with trans and gender diverse communities. And so I don't think that there's just one issue in particular to focus on, but, ensuring at the policy level that the representation is there. We're not taking 20 steps backwards in a time where it feels like that's what's happened in the past few years.
Definitely a lot of work is still to be done. Now, can you describe a particular memorable moment when your work has influenced your perspective on public health?
I think back to the early days of my research career. So when I was still learning how to conduct research, and I was doing, HIV testing at our research center as part of a study. So a lot of those conversations that I would have with people just around, overall risk for HIV, but also other sexually transmitted infections. So that work was really important. But I also, this may seem so random, but I have a collection of, I don't know if you've seen before, the giant microbes, they look like stuffed animals, but they're actually microbes. And a couple years ago, I was working out of a cubicle, and it became just like a well-known fact about me that I had these STIs, and, they look like giant stuffed animals to people. And so I kind of had to be like, no, it's not just like a stuffed rabbit, like it's an actual, or a stuffed snake. Like the syphilis microbe looks like it could be a snake. And one of my colleagues, I don't want to say what department they were in, but one of my colleagues came up to me and they were like, Kristen, I have a couple questions for you. And they proceeded to ask me a bunch of questions about the transmission of different STIs, including syphilis, including gonorrhea. And they were like, I felt comfortable asking you because you have these microbes and you've talked about them before. And so I knew that I could ask you and you wouldn't judge me. And, it was things that hopefully we would expect people learn in Sex Ed 101, but we also know that that is not implemented equitably across the board. Those individual level conversations have just as much impact as any manuscript I could write and submit to a journal. Like you can't convey that all the time in an academic article. So while those have their importance, those individual level conversations also have their importance as well. And
Dr. Kristen Krause, thank you for an insightful discussion today. We greatly appreciate your willingness to share your experiences in public health and valuable perspectives on addressing the unique challenges faced by gender diverse populations. Your dedication to advancing health equity is truly inspiring. All the best for the upcoming APHA event. Thank you.
Thank you so much for having me. I really appreciate it.